The model through which I think about brain fog, we discussed this in a prior video, I'm going to develop it a touch further here, has a few components to it. Nutritional. Do you have poor diet quality? Or perhaps you have poor absorption of the nutrition in your diet. So things that can be important like iron and B12 for cognition, you either aren't eating much of, or if you have poor gut health, poor absorption, you may not be assimilating a lot of those nutrients. So the first two items are nutrition and gut health. Hormones is also an important part. If you're an aging woman and you're going into menopause, then this can be a factor that's an easy win to improve cognition. Or if you're a younger woman with irregular cycles, PMS also might indicate that hormonal health could be implicated. Lifestyle. No discussion of brain fog would be complete if we didn't touch on the importance of exercise, for which it's been shown that being sedentary will literally lead your brain to shrink over time. Stress management, and there's some pretty easy techniques you can use to mitigate stress, and also sleep, hugely important. Another component to this would be neural or brain inflammation. And by addressing a lot of these factors, you will indirectly support and resolve neurological inflammation. But there are a couple supplements in particular that I've found benefit with, and there's some pretty good research showing can reduce brain inflammation. And then finally, infections. No discussion in my mind on brain fog would be complete if we didn't at least touch on how chronic and low-level infections in some cases can be leading to these plaguing symptoms like brain fog, but also perhaps fatigue and joint pain. So with that, let's jump in and talk about these really in no particular order. These are not in order of importance, but we'll start off with iron. Iron, as you probably know, is needed to make red blood cells. The red blood cells will carry oxygen and nutrients all over the body, including to the brain. Something that's less appreciated about iron is the fact that it's needed as a cofactor for synthesis of serotonin and dopamine. Dietary intake and absorption are two big factors here. Bear in mind also that those who are hypothyroid are at increased risk for iron malabsorption. We should start, logically, with asking, well, how do I know if I'm eating enough? And here's a list of the top 5 most iron-rich foods. Oysters or mussels, beef or beef liver, iron-fortified grains and cereals, and you might be someone who's not eating these, and that's fine, but just bear that not eating those foods is potentially thwarting dietary intake. Spinach that's cooked, and pistachios. What does the research show us regarding iron? Well, a 2021 study found that 80% of women with iron deficiency reported having brain fog. Okay, that's correlation. What about causation? A 2007 randomized control trial gave people, women specifically, who had low iron levels at baseline, either placebo or an iron supplement as 160 milligrams per day of ferrous sulfate iron for 4 months. They found that restoring ferritin, and ferritin is a blood marker that will give you probably the most sensitive and accurate assessment of iron status, getting the ferritin, simple blood test, back to normal. There was a 5 to 7-fold improvement in cognitive performance, leading these researchers to comment women who improved their ferritin status showed improvements in performance on attention, memory, and learning tasks. So bear in mind that dietary iron intake is important. If you have chronic diarrhea, constipation, ulcers, let's say, any sort of gastrointestinal condition that may lead to malabsorption, then gut health will be important to resolve toward better assimilation of iron. And your dietary intake is important. And also, if you are insufficient, supplementing with iron is a pretty easy method to bring those levels up, in addition to improving your diet and improving your gut health. Keep in mind that there is such a thing as too much iron, and iron is not a vitamin that if you over-supplement, your body will excrete, like vitamin C or maybe vitamin B12. That's a water-soluble vitamin. So I would not go on iron without having your levels checked. And a simple iron panel that includes serum iron, blood iron, but also ferritin is a great place to start. By the way, if this has been helpful, please comment and subscribe.